are hard to make, right? And I think that having that relationship, that strong relationship with your healthcare provider is so important for that reason. And we call it, like, we have a term that's called shared decision making. And it's really about a process that you work through with your healthcare provider in terms of balancing the pros and cons of each medical decision. Um, and from the provider aspect and from the patient aspect, right? Because you guys might have differing priorities, and I think it's important to for the both of you to understand what those priorities are, so you guys can meet on the same page. The Your obstetrician may lay out some data or evidence, but I think it's also important to follow up with how you feel about that information, and what are some of your personal drivers in terms of making those decisions. An example I can give, like, for example, is would you like to, like, if your pregnancy is continuing and you haven't necessarily gone into labor, what is the plan for induction, and when would you like that to be, and how would you like that to be? So then there's multiple examples like that in pregnancy. I could go on and on, but that was one of my personal clinical decisions that I made with my obstetrician. Was my pregnancy went till 42 weeks, and I really did not want to have an induction myself. And so it was really about deciding with my obstetrician how far are we comfortable letting this pregnancy go. And really where we met was at 42 weeks. And the day before I was supposed to go in for induction, I went into labor. So um,
Yeah.
all in all, it ended up the sort of the way that I had wanted it to be. But I definitely can say that having that shared decision conversation with my obstetrician was very helpful.
Yeah. Thank you.